Hello everybody, I am Maryam Bakhtiyari. I'm a dentist, general dentist, that my practice has been limited to orthodontics, sleep apnea, and TMJ for the last, I don't know, a decade basically. My practice is in Manhattan Beach, California. I'm going to present a case of using twin block, which is a functional appliance that is used for class 2 malocclusion, a retruded mandible cases that Susan showed with kids that have very retrognathic mandible. And I'm going to show you a case from that appliance. This is the first thing that anytime that I get a lecture or I get a podium to speak with, whether they're physicians, dentists, or physical therapists, chiropractors, this is what I always have. This is something I got from John Vitzik, bless his soul, and I have it in every room in practice. And all I have to say is mandible has a lot to do with our craniofacial pain. If the mandible is not placed in the correct position, if it's retrognathic even slightly, then we're looking at impingement of the neurovasculature posterior to condylar head and issues with balance because ear is right there. And so placement of the mandible in the nice physiologic position is my first goal in my practice. So whether I see children, adults, patients with craniofacial problem, we always take an x-ray to make sure that the condylar head is in the right place in the fossa, glenoid fossa. And if it's not, we unload the bearing there. We move the mandible, advance the mandible forward, and it solves that problem. I totally, truly believe that if dentists don't work together with physical therapists, chiropractors, ENTs, we're not going to get the full recovery from all the craniofacial problems. So I always tell my physical therapists or chiropractors that let me place the mandible in the correct position, balance the patient's muscle use, and then you go ahead and start your adjustments because the adjustments held very much better. So that's the first thing I always show. So I have a patient that is my employee now. She was 14 when I treated her. And because I treat sleep, so anybody that comes with a class 2 malocclusion and tells me that they snore or they don't have a great sleep, we get a sleep study done on those patients so that we can see if we can use their medical coverage or we can better assess the patient. So she had moderate sleep apnea, she snored, but her main problem was migraine. And she was in and out of our local hospital for migraine shots with morphine shots at 14. So she was missing lots of schoolwork, school days. Old days, we had a lateral ceph that we took. It just shows how much retrognathic she is. We're about over 10 millimeters retrognathic mandible. So I met this patient because the father was my dad's gardener. He stopped me in the street and says, they want to do jaw surgery on my daughter. Can you see her for consultation? And the first moment I saw Daisy, my concern was you get migraine. And the dad was stunned that, how do you know she gets migraine? And I said, you know, it doesn't take too much to know. That much retrognathia, the pressure that's in the area of the TM joint. So we put her on twin block so many years ago and moved her jaw forward. And this is Daisy. You can see how much. This is a 14-year-old face. So you can see the retrognathic mandible. So when I see that much mandible that's posteriorly placed, I'm worried always about the airway. So we know that she has airway issue before even getting the sleep study done. So we put a twin block on this young lady. Now this is not her twin block. We couldn't find her archive. So I took somebody similar to her and I brought the twin block just to see what the twin block does. So it actually, the blocks move the mandible forward. Kids have to eat with them. They sleep with them. They use them about a year. So 8 months to a year time. And what we do is we shave some of the pads in the back and we allow the permanent teeth to erupt in the position that we want. It sounds like it's a lot of work, but it's actually a pretty comfortable appliance once the kids are used to it. When a kid has craniofacial pain and they have postural issues, they wake up tired. It only takes them a week to get used to this because they know when they take it out, they're back into the same, the pains and so forth. So we have no problem with compliance. At the same time, these appliances, we can have screws on them and do different orthopedic corrections. So if they're crowded, we can have screw and expand the mandible, expand the maxilla, develop the upper palate if they're A-point and the palatal bone is back. We can develop the upper palate. So we can do everything along with forwarding the mandible. So this has been my first appliance of choice for kids that are compliant, to get most of the functional correction done before we get to braces. So you can see there's screws. We have some side screws that develops the mandible laterally, expands it centrally. Same thing on the maxilla. And then these are the blocks they eat actually with. And this is where we shave every month and allowing the teeth of the permanent teeth to erupt in that point. And it will get in a point that patients, when they take their appliance, they have permanent bite correction. I know Albert is an expert in this. So this is her x-ray at 27. So we just bought this CT scan, and we were able to, we could just see her airway now, much better clear. This is her now at 27. This is her mouth at 27. So you can see that it really helped. I mean, the mandible stays in the position. A lot of orthodontists in my neighborhood, they constantly argue with me that, oh yeah, it'll go back. Sometimes we have dual bite, but we're not going to go back 10 millimeters. We may go back 2 millimeters. She looked better when we finished, but that is not at all crucial in her overall health. So this is her 18 months after treatment. She had no apnea anymore, no more migraine. The migraine goes away the week after they have the appliance. I can't say immediately, but really immediately once you unload the disc, put the jaw in the right position, we took care of the headaches and so forth. So there's no snoring, no neck pain. She's been working for me the last few years, and there's no need of surgery. This is her after we finished treatment when she was 16. We did expand a little bit also. This, you can see the facial structure, the balance in the facial muscle, the neck. She lost weight because now her airway is opened up. This is her today at 27. You can see still we got a pretty nice profile. The bite is still pretty stable. And that was the case of Daisy. If anybody has any questions, since I finished so fast, I totally believe that as a group that you guys are, we can all work together. Those of us that don't have a dentist or a SOT chiropractor, we need to really look up and work together. If we want the process to be much easier and patients to be more happy, we need to work together. I think dentists, there's a book called Dental Physician. I think as dentists, our role is way more important than just being a dentist or failed medical students, because in my practice in Manhattan Beach, I treat so many patients with ailments that are out of the box, and I have physicians actually give me a call and say, listen, I have an out of the box kid, do you think you can help them? Any ear issues that they can't treat, any type of a balance issue they cannot treat. I've treated 25 Parkinson's patients. I have several Tourette's movement disorder kids that we treated. I'm not going to stand here and advocate that I'm treating those ailments, but treating TMJ portion of the ailment and the airway of the ailment, opening the maxilla so the kid is promoted nasal breathing, teaching him how to swallow. All of this is what my office practice is, and that's my goal in life. That's why I'm here, to be able to get one more person in the same goal and get to where we want to go as whole, to be able to have a healthier future, children, and healthier America. That's where I am right now. So any questions? I'm open. I'm done.
Yes. How many dentists do you think are out there that read Albert Fonder and the dental physician?
Okay, so I actually want to let you know that Dr. Fonder's book, I have it. There's not even one copy of it out in Amazon or anywhere. It's destroyed. I've looked at all his case studies on Down syndrome, on patients with eczema, and I've treated many cases because of, luckily, having a husband who's an MD. We got a lot of physicians on board. So I do get cases that parents want to be treated. But I don't know of anybody. But anywhere I go, I take the book. So I do a lot of teach and learn in my office. So we do a lot of CE work. Anybody that comes, the first thing I talk about is the dental physician book. How many cases he's done treating different ailments, back as scoliosis. I mean, it's just amazing book. Nutrition. There's not just one side of the treatment. We have dental treatment, chiropractic alignments. We have now nutrition. So that's one thing that we also talk to patients, nutrition. Now talking about parasite, I just learned about parasite a month ago, and I start advocating it and being here, and she's speaking about the same thing. So whatever comes that's non-invasive, that makes sense to me, I advocate it, right? So there's not too many people know Al Fonder. No, it's very sad, yeah. In my organizations, like American Academy of Craniofacial Pain or International Board of Orthodontics, everybody knows Alfonder. And we're looking at a couple thousand people. But in dental organization, nobody knows about it. I'm probably the only one in Manhattan Beach that has that book. So I'm done. Thank you very much.